I've got this doctor who's doing the stroke scale on me, and he's asking me if I can see his fingers wiggling. And I'm trying to tell him, no, but I have history of diabetic neuropathy with laser surgery on my retinas that has ruined my peripheral vision. So I couldn't tell you if I was having a visual stroke because I can't see until about here. He wasn't listening to me. I'm probably sure the bill is going to be huge for a doctor that did nothing for me, just wiggle his fingers.
This is the Recovery After Stroke podcast with Bill Gassiamis, helping you navigate recovery after stroke.
Hello and welcome once again to the Recovery After Stroke podcast. This is episode 239 and my guest today is nurse Jim Fox. In our discussion, we discuss Jim's journey of living with type 1 diabetes, overcoming addiction and healing after an ischemic stroke. Jim Fox, welcome to the podcast.
Hello, how are you?
I'm well, thank you, Jim. Tell me a little bit about what happened to you.
November 13th of 2022, I woke up, started a fire in my wood stove, and then I went back to bed. And then I woke up, tried to use my cell phone, and I wasn't able to use fine motor control to type in a message to my wife, good morning, because my wife's a registered nurse also. We're both nurses. So she works in an ICU. I used to work in ER. So we've got a little bit of history with medicine. So
you couldn't type the good morning message?
I could not. No. At the time, I realized that I was having problems with speaking too. I went to talk to my dog, of all things, and I was garbled. So I knew at that time that I was having a stroke. I absolutely knew it. So I got up, tried to call 911. And the thing about it is that I didn't even attempt to use my left hand. It was my right hand that I had the stroke in. So my right side,
It didn't occur to you to just swap over the hands for a moment?
No. So the kicker is that I was having a stroke throughout the day before. So it was coming and going. So I went to lunch from work, got in my truck, and when I got out to the street, I pushed on the gas pedal.
Mm-hmm.
And you wouldn't think that there's fine motor control with your gas pedal, but I pushed my foot down and the truck jumped out in the street. And I went to turn. When I went to turn the wheel, it slipped out of my hand. So I had to grab it with my left hand. And then I was able to grab it with both hands and then figure out, like, what the heck is wrong with my truck?
It was the truck.
It was the truck. Drove all, and I've heard you talk to other people on your podcast about how they drove, and it was always something else. Look, I've been trained in emergency medicine, certified emergency room nurse, trained in the NIH stroke scale, Cincinnati stroke scale, educated. I drove home. Once I got home, the symptoms resolved. So it was coming and going. Had lunch, drove back to work, and then it was my PIN. I didn't put two and two together. my pen wasn't writing. It was, I wasn't writing with my right hand.
Mm-hmm.
So off and on, off and on. I currently work as a dialysis nurse, and I was getting patients off, and when I got out of my chair, I stumbled, and it just went from there. I had a little bit of slurred speech, but I'm a type 1 diabetic also.
Mm-hmm.
So I have symptoms like that when my blood sugar's low.
Uh-huh.
So I had something to eat. The speech went away. I went home, and I was really tired. Mind you, I get up at 4 a.m. or 3 a.m. to go to work at 4 a.m. and then work a 12-hour shift and come home.
Mm-hmm.
Came home, went and sat in the backyard. I mean, it was like 55 degrees out, and I just sat there just thinking, what is wrong? I had this feeling of doom.
Uh-huh.
I had this feeling of, I've never told my wife this, so she's probably gonna watch this and listen and go, oh shit. So yeah. So I went to bed and I slept all night. And I got up the next morning. My wife had gotten to work. She got up at 5:45 to be work at 7 o'clock. And she was at work. I couldn't call 911, so she called 911.
Hang on a sec. How did that happen though? Because you couldn't type the message to her. You couldn't speak to the dog. How did she
But
actually understand what was happening?
so in the middle of that, I know I'm kind of piecemeal
That's
because
all right.
my brain is still just,
I understand.
this is so new.
I understand.
So
I'll guide you.
you'll guide me through it. In the middle of it, I was able to type a message to her.
Uh-huh.
By that time, I had switched to my left hand,
Uh-huh.
and I texted her stroke, STROKE.
Wow.
And my son, who's 16, comes out of the room just before all that, and he said good morning, and I'm kind of grumpy in the morning anyways. And I grumbled at him. I said good morning, but it was a grumble because I was slurred speech. So he went into the kitchen, got something to eat, went back to his bedroom, and then he came out with his phone and said, Mom wants you to smile. And at that point, I smiled and was able to speak, kind of. Smiled, stuck my tongue out, put my arms out. You put your arms out one way and then you hold them up, and you've been through the
Yeah.
deal.
Yeah. The stroke test.
So she said, I called 911. So the ambulance gets here, the fire truck gets here. I'm not sure if they do that in Australia.
They don't, but we're very familiar with the fact that you guys have your fire trucks loaded with paramedics, I believe.
Some places have paramedics. I'm not sure about city of Shasta Lake, or I'm not even sure if it was the city of Redding or the city of Shasta Lake that developed. I live right on a line. Cities on, I could throw a rock at the city of Redding, and I have Shasta Lake on the other side where I live. So it could have been one or the other. So we have them. I squeezed their hands. I held my hands out, and then the ambulance drove up just after the fire truck got there. I walked out to them. I was having weakness in my left leg, but I was able to control it, kind of, because I I can't believe I did it. I walked out there. I could have fallen and hit my head and ended up with the bleed.
Mm-hmm.
But I'm so stupid. Or
You're normal.
you know,
It's what we all did. It's what we all did. There's so many stroke survivors have done something like that. But I get it. I get that comment that you made about yourself. You know, you were so stupid, but you were having a stroke. Like, it's okay. You know, your brain is not really working the way that it needs to be, but it is. But there is another part of you that's working. That's the part that's getting you moving to go towards help, right? So you are being proactive towards your support and your recovery because you're moving towards help. You've done all the right things, even though they've been in a haphazard way or they haven't been efficient or whatever they haven't been. They're still all the right things, you know. Stroke, you typed, you became involved in that part of the process, which was, you know, to test whether you're having a stroke or not, the fast signs that everyone took you through, and then you walked towards the ambulance. If you'd fallen, maybe you would have tripped, maybe you wouldn't have hit your head. If you had blacked out and fallen, you might have hit your head, and then that would have been really dramatic, but you didn't. So don't worry about it. You got there, and now you're about to enter the ambulance, right? Is that what's happening? Or
so
are you waiting for the ambulance to arrive because the fire guys are there?
I mean, it was like the fire truck stopped, parked, they got out, they tested me for what little they know.
Mm-hmm.
And then the ambulance pulled in and opened the EMT got out, opened the door, the paramedic pulled the gurney out and set me down on it, got me in the truck. My cute little neighbors come out, like they're crying. Oh my God, they're so cute. Carl and Janet. I've been neighbors with them for 23 years.
Hi everyone, just a quick break and we'll be right back to the interview. As a stroke survivor, I understand the difficulties of finding the right information about post-stroke nutrition. So I developed a course, The 5 Foods to Avoid After a Stroke. While most people are talking about what to eat after stroke to support brain health and recovery, very few are talking about what you should avoid eating after stroke. If you want to support your brain to heal and you are curious about the 5 foods that may make matters worse when you consume them, then this course may be for you. In the Fun 5 series of interviews, you will hear about what foods not to eat after stroke, but most importantly, why. The interviews are done with a qualified nutritionist, Stacey Turner, and performance coach, Matthias Turner. In the more than 5 hours of interviews, we discuss the 5 common foods that cause inflammation in the body and brain and how they could interfere with healing and how they could make fatigue worse. For just $49, this 5-part series of more than 8 hours of interviews will, with full PDF transcripts, MP3s and videos, will give you everything you need to know about the foods to avoid and why. The modules include 8 reasons to quit sugar after stroke, 7 reasons to quit caffeine after stroke, 8 reasons to quit gluten after stroke, 6 reasons to quit dairy after stroke, and 6 reasons to quit alcohol after stroke. So visit recoveryafterstroke.com/courses for this and other specifically designed courses that are made by a stroke survivor for stroke survivors. Once again, you'll get more than 8 hours of content. All audio is downloadable in MP3 format so you can listen on the go. Full transcripts of all the content to take notes on are available for download or so that you can read instead of listen. Presented by a stroke survivor, for stroke survivors, also presented by a trained nutritionist and performance coach, you'll get 24-hour access, lifetime access to the courses purchased, and you'll be able to interact with me in the comments section. Go to recoveryafterstroke.com and check them out now. You're one of the family.
Yeah. So they were crying and said, you're gonna be okay. I've had a stroke before, Carl said.
Oh.
You can get through this. So we get to the get to the ambulance. They put an IV in me. They put the EKG on me. They put no, they don't put oxygen on. They stopped doing that. But they did all the other stuff.
Yeah.
They didn't give me aspirin because they couldn't tell that I was having a bleed or if I was having
Right.
a clot.
Ischemic. Yep.
So ischemic stroke versus clot.
Yeah.
Or so got to the emergency room, and my wife's there. My daughter's there. I have no idea how my daughter got there, but she was there. And then the intensivist was there because my wife is friends with the intensivist. And
what's an intensivist?
The only work she does is an intensive care doctor.
Uh-huh.
So I've got an ICU nurse, I've got an intensivist there, and please forgive me, but I'm going to say I get the doctor that I dislike the most out of all the doctors I've ever worked in the emergency room that I worked in, that I helped run, and here this guy is.
And now that's on your mind when all this other stuff is happening.
All this other stuff is happening, and now I've got this doctor who's doing the stroke scale on me.
Yeah.
And he's asking me if I can see his fingers wiggling.
Yeah.
And I'm trying to tell him no, but I have history of diabetic neuropathy with laser surgery on my retinas that has ruined my peripheral vision. So I couldn't tell you if I was having a visual stroke because I can't see until about here.
Anyway,
he wasn't listening to me. I'm probably sure the bill is going to be huge for a doctor that did nothing for me, just wiggle his fingers. But I got to the CT scanner. The neuro-intensive care doctor that retrieves clots has been called as in the CT scanner. I mean, I got the best care on the planet waiting for me. I got the 18.
Yeah.
Right. They do the scan. They give me dye. They do this with the scan, and then they do another scan with an IV dye.
Mm-hmm.
And my wife comes back in to tell me that it's not a bleed, but the doctor wants to look at the scans as they go through. So we have a carotid artery that comes off our neck. There's two lines. The M1 is the first vessel that comes off the carotid on my left side, is 90% occluded. So they decide that since I woke up with the stroke, I can't give them a time exactly, that we're not going to do the TPA.
Right. Too many hours have passed.
Too many hours have passed. They couldn't tell, but the problem being was that the risk outweighed the benefits.
I hear you.
For the little symptoms that I had. Give the TPA, blow a blood vessel, end up a vegetable. We'll treat you medically. You're talking, you're walking. Was able to transfer from the CT scanner table to the ER gurney. So I've gone from the paramedic gurney to the ER gurney, back to the emergency room. And still, it's just so much. It's like, oh my God, this is really happening. so much is going on, so many things
Yeah.
going through my brain.
Yeah.
So at this point, my speech is very slurred. I
Mm-hmm.
can agree with them. I can people are telling me that my speech isn't as bad as it could be.
Yes.
So we get transferred to the ICU, and we're going to do an MRI scan the next day. So I'm being admitted for observation. I'm going to start on Plavix. They gave me aspirin. I'm not sure if they gave me Lovenox or not. So much went on. So we did that. We're doing all of the hourly stroke stuff.
Mm-hmm.
My wife has to go home. She's got to get some sleep. She's been up all day, and now it's 11 o'clock at night. The day's just flown by. And I give her a kiss, and she goes home. My kids are all gone. It's just me in this ICU room. The scanner, or not scanner, but the monitors is beeping. My blood pressure's 190 over 106. So it's called permissive hypertension.
What does that mean?
That means that we don't want to change one's blood pressure too fast, because you've got your blood pressure is high for a reason. Our bodies do stuff not because it wants to, because it's trying to get as much blood to my brain as possible. Increase the pressure, get the blood in there. So I at this point I'm slurring still, and I'm like, shit. So I take my phone out. I got earbuds in, and I start playing music. I can't even remember what music. Maybe it was Pink that I was listening to. And I'm a big fan of Pink.
Yeah.
I'm 50. Cool. She's way cool. I'm 54 years old, and I'm listening to Pink, right? And about halfway through the first song, this is weird, I start singing. I can sing the words to the music I know, but I'm having trouble with words forming to tell people how I'm feeling or how I'm doing.
Wow. But you can sing the song,
but
you can't speak under normal circumstances as we are speaking now, but you can sing a song. You're probably a terrible singer. I don't imagine you're a great singer. But nonetheless, you do something that resembles singing.
I'm not singing way out loud like Pink does, but I'm saying I'm mouthing the words, and it's coming out of my mouth, and I'm like, this is weird.
Yeah.
So I told the nurse this, and she said, well, I guess that's a plus, right?
Yeah.
You know, it's now 3 o'clock in the morning, and I'm not slept, and actually I'm not going to sleep all night.
Yeah.
I just can't.
What's it like, Jim? What's it like to be on the other side of the hospital bed? You're the guy that goes around and cares for people and makes sure they're well. And now you find yourself on the receiving end of that care as a patient. Did you ever in your wildest dreams imagine that you one day might be a patient in the hospital where you're so familiar?
Yes.
You did. It had crossed your mind. Okay.
Oh, the thing about it is I didn't think it would be my brain.
Okay.
I thought it would be my heart.
Mm-hmm.
I've been a diabetic since 1976.
Type
I
1.
was diagnosed. I was diagnosed when I was 9.
Mm-hmm.
Look, I've taken care of lots of diabetics.
I see.
I knew that it was going to happen. I just did. Uh, Living every moment that I can as best I can.
Mm-hmm.
I'm telling you that I'm the sunny and roses and rainbows coming out of my butthole, and it's it's not like that. I'm a normal human being. I can be crabby.
Mm-hmm.
Um, if my blood sugars are high, I can be an asshole. If
Mm-hmm.
my blood sugars are low, I can be violent.
Oh,
Um, it's because it's the diabetes.
right. Okay. So when you find yourself in that situation, is it comforting to know the medical stuff that you know about what they're doing next and how they're going about this? Is that good, or are you overthinking the negative side of that because you've seen some of the the bad luck stories?
um, Bad luck stories. I've seen ugly, awful, horrible things.
Mm.
Um, I don't sleep because of those ugly, awful, horrible things. I'm If you want to call in the middle of the night, I'll be awake. But
Are you generally a positive outlook kind of guy, or are you not that way inclined? I'm just trying to get a sense of what a nurse who has your history in in helping other people and what you've seen goes about thinking about their own experience with a life-threatening situation.
look, I know. Actually, I know for a fact that I'm going to die. Right? We're
We
we're,
all
we're
are.
all good. We're all going to die.
Yeah, right.
It's part of the deal.
Yeah.
Um, I know things. I know that the worst things can happen. Um, I always try to be upbeat and happy
Mm-hmm.
and joke and laugh
Mm-hmm.
because I truly think there's really no better medicine than laughter.
Yes.
If you've had a stroke and you're in recovery, you'll know what a scary and confusing time it can be. You're likely to have a lot of questions going through your mind. Like, how long will it take to recover? Will I actually recover? What things should I avoid in case I make matters worse? Doctors will explain things, but obviously you've never had a stroke before. You probably don't know what questions to ask. If this is you, you may be missing out on doing things that could help speed up your recovery. If you're finding yourself in that situation, stop worrying and head to recoveryafterstroke.com, where you can download a guide that will help you. It's called 7 Questions to Ask Your Doctor About Your Stroke. These 7 questions are the ones Bill wished he'd asked when he was recovering from a stroke. They'll not only help you better understand your condition, they'll help you take a more active role in your recovery. Head to the website now, recoveryafterstroke.com, and download the guide. It's free.
Some of the stuff that I've seen and help people through, to be able to laugh with them and joke with them, to get them through it, helps.
Yeah.
That in the question about the bed,
Mm.
the hospital bed, I grew up in a pediatrics ward at the same hospital that I'm in now.
Uh-huh.
Lots of time in the
Experience.
hospital.
Yeah.
Hospital experience as a patient, 100%.
Right.
I've heard you talk about how you when you went in for your surgery, how you went in as the best patient that they'd ever seen, right?
That was my intention.
That's it. When I'm in the hospital, I'll be the best patient you've ever had.
Mm.
I'll be nice. I'll be cooperative. I'll let you do what you need done. I will go beyond what needs to be done. So the part about being under the other side of the bed is it's scary. It's just, it is scary. It's what it is. I mean,
I hear. Yeah, I get what you're saying in that you're expressing it differently to most other stroke survivors who have had a stroke, who are not in the medical field, who are not caregivers, who are not nurses. You know, most other stroke survivors go down the path of, they can clearly tell me, you know, it was the time when they realized they were mortal. It was a difficult time. It was all of this. And they didn't have that years of experience of seeing good outcomes and seeing negative outcomes and seeing people pass away and the rest of it. So we're not, what's the word? We haven't been programmed to know that that's part of life. So when it comes our way, it's like, oh, this is unexpected. I didn't expect that this would ever happen to me. Your experience is extremely interesting to me to listen to, because you were a diabetic patient, because you're a nurse. You've got a whole much broader range of knowledge and information about a topic like stroke than the average person. And your approach is really, what is it? I mean, for me, listening to your approach about we're all going to die and all that, it's kind of comforting, even though you're very gently matter of fact. It's still kind of comforting to see that from you, and to know what you know, and to have been through what you're through. You seem to have an acceptance that most people don't have. And it's a great skill. And it's why I'm going there, to try and understand it, right? It's acceptance. I feel like that's what it is. Would you describe it as acceptance?
It's acceptance with a lot of gratitude involved.
Right.
Because in 2010, and this is going to be an interesting story. 2010, my father had a massive stroke. So I have a familiar history of stroke also. Massive stroke, intubated, they didn't know where his family was when he had the stroke, and it took a couple days. And of all the things, a girl I dated when I first got my nursing license was working in the ICU and saw my dad's name. And my dad was Loyd James Fox Jr. My legal name is Loyd James Fox III.
I love it.
So they found out that it was my dad. They called my house. I was in the mountains camping with my 5-year-old son, who was just about ready to go to kindergarten. So he had the stroke, and then all hell broke loose. My dad was an alcoholic, and he passed that gene on to me. But I take things just a little bit beyond that. So at that point in 2010, I was taking opiates for shoulder injury that I got working in the ER, and got hooked on them. A doctor in 2014 decided that he was going to stop prescribing them. What does one do when he's got a candy machine at work that develops, that gives you whatever you want? I'm not saying it's the right thing to do, but I ended up as a full-fledged addict. and suffering miserably because I didn't have what I needed. I was, it was awful. It was god awful.
You were in withdrawal or not able to access
I'd
the
get
opioids.
drugs during the beginning of the week, of my work week, and then by the end of my weekend, I would be in withdrawals.
Mm-hmm.
So I got caught. I entered a program for nurses in California here that allows you to get your license, hold your license so you can't work, really work on yourself, weekly counseling, weekly nurse support meetings, weekly or daily for a year, Narcotics Anonymous meetings.
Okay, hang on a second. What you're telling me, there is a need for a specific program for addicted nurses to be able to attend rehabilitation while maintaining their license, going through this rehabilitation process to get to the other side and then hopefully be well enough to go back to work?
Yep. Doctors, nurses, dentists, pharmacists, lawyers.
That is fucking amazing.
It is amazing.
That's amazing. So instead of treating people who get addicted like criminals and taking their license, they're practicing their ability to practice away and the rest of it, they're supporting those people get rehabilitated and get off the addictive substances and get back to work.
Yeah.
Man,
yeah.
That is amazing. I absolutely love the sound of that. And I don't like the fact that you ended up there or that there's a need for it, but what an amazing program.
Amazing so much that when I got out of the program in 2018, I ended up with pneumonia. They gave me morphine for air hunger, and it started all over again.
Hang on a sec. What's air hunger?
Air hunger is what you can get when you can't breathe. Morphine relaxes you enough to where you can breathe.
Okay. And and morphine is it a long-term solution to a long-term problem, or is it a short-term solution to a short-term problem? What's the
short-term
air hunger?
problem?
It's just a short-term thing, and then it's something to help get you over the line. But do they know your addictive personality, and do you go there willingly, or do you get concerned? Oh gosh, I'm going to be prescribed morphine. Is that going to continue the situation?
I thought I could handle it.
Okay.
I thought I had this and I could get through it, and I was wrong.
Right.
I did the program twice.
Mm-hmm.
8 years. So get through the program. I've got enough gratitude that when I go to bed every night, I make a list of what I'm grateful for.
Mm-hmm.
From the smallest things of that I've got kindling in my bucket,
Mm-hmm.
because my son made it for me, to the fact that I was able to get through the day without hurting anybody's feelings or break anybody's heart. So back to the question of where I was sitting in that bed, I was grateful for the fact that I was sitting there. alive. I know I'm going to go. I know that my life is shortened with my diabetes. I'm not ready to go.
Uh-huh.
And, but if I've heard you say God, higher power, the universe, whatever might be out there, I'm ready to go see if they want to take me. But if I'm not good, if it's not my time today, let's get on with this.
Yeah. Let's make the most
So,
of it, right?
Yeah.
Yeah. So it's quite the journey. Diabetes at 9, and then the challenges that you have to face with addiction, and then the relapse and all that. You're 54 now. Does it get easier as you get older? Do you grow the resilience that you need to make the bouts of the things that you do that impact your life negatively? Have you got to the point where you're decreasing the extent of the, I'm not sure if the word's damage, but the extent of the, I'm going to use it anyway because I don't have another word, the extent of the damage that you cause in that time when you're addicted or etc. Do you know, have you kind of become more skillful at moving beyond it and letting it go and dropping that behavior that causes the addictions and so on?
So this is the gist of it, is that people, I used to think my dad was lying, that when he talked about his 12-step program, I thought it was a place that he just went to drink coffee.
Okay.
Right? And if he had lived long enough, I would have to give him an amends for that. So, about that feeling I had, but those were my feelings, and you can't take it away until you walk a mile in someone else's shoes. You don't know.
Yeah, they're legitimate, and they come from ignorance because you don't know any better and you make assumptions, and that's what happens. And I've learned that lesson as a stroke survivor. There's no doubt that I judged people who spoke differently, walked differently, than quote unquote somebody who was normal or physically normal. And then I had a stroke, and then it's like, oh, okay, what an idiot you were. And it was a genuine idiotic way to be because I was so ignorant. I had no life experience. I had never been through something that impacted my ability to be myself. And it was the most information that I had. So I did the best with it as I could. And I didn't seek out enough information to make the correct decision about how I'm going to approach somebody or speak to somebody. But that's one of the wisdoms that came with having this episode 11 years ago. That's one of the things that I gained from it. I gained the wisdom to not judge people and to give them the benefit of the doubt, and not to take their behavior to heart and be personally wounded and offended by it. Now, I can say that to you as a 48-year-old, but there's no way I could put that sentence together as a 23-year-old. Of course, I'm going to take that to heart. Of course, I'm going to be wounded by their comments. Of course, I'm going to think it's personal. I don't now, but and you would have been similar. You would have been in a similar situation. That's what your addiction taught you, amongst other things. It taught you to have compassion, by the sound of things, towards your father.
Yeah. Yep. So as for the wreckage of my behaviors, you walk through those 12 steps, and they're my steps. If you want to go to a meeting, there's a meeting everywhere.
Yeah.
So I recommend, if you feel you have to go. But that's not the message I'm sending here today. The message I'm sending here today is that I've got gratitude in everything I do. So my wife, this is how well it's gone, is that my wife took off 3 months to walk me through and help me with my recovery. You know, you don't get that unless they really care. And I had always wondered about my the amends I gave to her, and asking her for her forgiveness.
Let's do the conversation that I really don't know how to do well anyway. Let's talk about karma. In a past life, you must have done some amazing things to get so lucky to get a wife like that, who has the background that she has, who has that understanding that she has, who can support you and guide you through a situation like that. I mean, that is such an amazing thing for somebody in your situation to have as a support mechanism, because many people who are addicts don't have that kind of support mechanism at home. They can seek out the best type of support they can out of the home, but then they may not have that additional layer of support.
Yep. So she's so supportive that she's agreed to some pretty expensive treatments. You can't call them treatments. Some steps I've taken to help heal my stroke. We over here to my right, I showed you earlier the hyperbaric chamber. $14,000. Right. I have a really good friend who used to be an ER doctor, who now does rejuvenative medicine. And he gave me a list of things that you should do, that I should do, that he was doing, because he has a coronary artery disease and he's trying to fix it. This was one of the things that he mentioned to me, but I kind of call this is going to sound funny, the voodoo medicine, because nothing's been proven that this works.
Yeah.
But I'm willing to take that chance.
Yeah. Hyperbaric therapy's been used effectively for knee injuries and for other ailments. I know for sure there's even probably good research about it. And as a nurse, I know that you want to make sure most of the time that what you're doing and treating and how you're treating people and what you're prescribing them, there's scientific evidence and real good proof that it works and that it's not harmful, and it's more helpful than harmful, right? And now you're going into this space of out of the medical field, so to speak, out of what you're used to.
I'm going right to that line.
Yeah.
You know,
I was going to say, and I see that in so many stroke survivors who will tell you that Reiki is rubbish until they have a stroke, and then they're straight at the Reiki practitioner, or they'll tell you that meditation is rubbish, and then they're meditating. For me, I went down that path, and I would have tried anything. I would have tried slapping two fish together if I thought that there was a possibility that might make my recovery continue and be better. So I get it. Like I know that there's the desire to solve problems, and at least you're going about it in a way that I think is quite reasonable. It's a recommendation from a doctor. The therapy is proven for other challenges, and it's most likely not going to cause harm. It is going to cause some positive outcomes, and if it doesn't necessarily heal your brain in that specific spot, it's probably doing good to the rest of your body.
So this is kind of weird. Over the last 2 or 3 years, when I get little cuts on my hands or stuff, it takes a while for those wounds to heal. I have a blacksmith shop in my backyard, basically. And when I'm out there hitting hot steel and stuff, I can get injuries. Well, my wounds on my hands are healing like 10 times better than before I got this thing. So it's helping the wounds on my hand or the scrapes on my legs to heal. So I'm hoping that it helps in my brain.
Right.
That being said, is that in China, Russia, Britain, I'm not sure about Australia.
Mm-hmm.
They pay for all kinds of different things. In the United States, they pay for the hyperbaric treatments.
Right.
They only pay for hyperbaric treatments for certain things: sudden stroke of the eye, gangrene,
Mm-hmm.
Diabetic foot wounds, burn wounds that aren't healing.
Mm-hmm.
So they've got like 9 things that the United States only pays for. So this is out of my pocket. But if I were in Britain, or if I were in Russia, if I was in China, I would be in one of these things.
Yes.
And it wouldn't cost me anything.
Yes. Yes.
So
out of curiosity, how long do you spend in the chamber? How does the therapy session go?
So what I do is that I wear an insulin pump. So it gives me insulin throughout the day. I'll give 3 units of insulin, get in the chamber. I have to take the pump off because it doesn't handle the pressure. Get in the chamber, turn it on, and then I'll sit in the chamber from anywhere from an hour to 3 hours. So I've spent a lot of time in there since I had the stroke in November.
Okay. Did you notice any changes? Is there something that you can hang your hat on? Can you say, this is what, other than the scars on my hand and all that stuff, did you notice anything different? Now, I am in fact very impressed that 3 months after your stroke, you're on my podcast. That's amazing. That's just fabulous that somebody is capable of doing that after a stroke. And I'm grateful for that. But then I do notice that you have some fragmentation in your thinking and in your speech and in your ability to begin and finish sentences, which I don't know if it's your normal way of speaking or it's as a result of the stroke, but that's how I was. I'm very familiar with the feedback I was getting from my wife and other people about how I was communicating after the second bleed that I had. So am I seeing you the way you were before stroke, or am I seeing a slightly different way of communicating? And to make the question a bit shorter than it has been, and what have you noticed about the hyperbaric chamber with regards to your stroke recovery?
So I feel that my speaking is better. When I first had the stroke, I had to stop. My brain has always been bing, 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 bounce around this subject to that subject.
Mm-hmm.
That's not new. Me going from one subject to another, sometimes I have to be straightened out. Or well, what about this? What about that? Or I'll just keep rambling. When I had the stroke, when I started to talk like I did when I normally did, I would slur all my words. All of my words sounded like I was drunk. So I had to slow my thinking down and my speech down. I'm doing that just because this is the way it had to be after the stroke. Right after the stroke, I had to slow it down. So the hyperbaric chamber was not my idea. It was my friend Mike's idea. Mike Anderson, one of the best men I've ever met in my life. His son ended up with a C7 fracture. We had some big fires in 2019, I think. Big fires. Burnt his house down, left his garage. His son ended up with a C7 fracture. Ended up with a wound driving from San Diego to Redding because of a heater in the seat that got bumped. So they treated him for that wound in a hyperbaric chamber, a hard chamber. And then after the 40 treatments is the normal prescription for hyperbarics. And after the treatment, they bought a system and was using it. Well, they healed, and it was just sitting in his house. He invited me over and said, "Hey, why don't you get in this?" After he found out that I had a stroke. So
that's how you got to it. So, okay, that's great. Now, I've done a bit of a online search about the benefits of hyperbaric therapy, right? And it says it supports wounds to heal. It supports people who have had carbon monoxide poisoning. It can help reduce the harmful effects of that. It helps people reduce swelling and promote healing when they've had severe crush injuries.
Correct.
It can help prevent and spread the spread of gas gangrene, a serious bacterial infection, by increasing the delivery of oxygen to the affected areas. Okay. It all sounds legit, you know. Increasing oxygen to that brain is really good for the brain to heal and to operate better. It can help reduce the symptoms of decompression sickness, which is what we know hyperbaric therapy for more than anything, isn't it? Diving
exactly.
And having the bends and getting the bends. It can help reduce the effects of radiation injury by increasing the amount of oxygen in the bloodstream. So for cancer patients, I imagine that is a useful tool. And it definitely mentions burns. It can help reduce pain promote healing and reduce scarring in people with burns. And it can, and it is used by athletes. It supports improving apparently athletic performance by increasing the delivery of oxygen to the muscles. Okay. Yeah. There is no doubt that it has a medical benefit because it's been used to bring people back from the bends for many, many, many years before it was applied to other areas of medicine and before other people started to use it, for example, for burns and the things that the reasons that you're using it. So I think this is going to make people curious. I did not know that you can buy one for $14,000. I mean, it's not cheap, but the fact that you can buy one and have it in your home and access it, and even then, I imagine once you're done with it, there'd be a secondhand market for a good condition hyperbaric chamber, and it may not end up costing you the full 14 grand. You may have to just cough out and pay for the amount that you lost in the buying and then selling of the product. And then I did a search just while we were talking about hyperbaric therapy in Australia. Again, I didn't know that it existed. There's an organization here that sells tanks, and they have different versions of them, and they start at about 20,000 Australian dollars, which is roughly the equivalent. By the time you do the conversion, all that kind of stuff, it's a similar amount to what you paid. And then they have a more expensive version, which is about $23,000. But I am just stunned that is so accessible these days. I know $20,000 is not accessible for everybody, but it's more accessible than it's ever been. And I think you can rent them as well.
That's what I'm doing with this one.
Yeah.
I'm renting it. So it was a big cost to rent it, but I've decided I could rent this one and own it at the end of the 3 months. But I've decided that I want something that has an air conditioner involved
inside of it. Yeah. Okay.
Because you start taking science into this stuff. Boyle's law, you increase pressure, you increase the temperature. This unit doesn't have a dehumidifier on it, so you get when you compress air, you humidify. You're pushing the air in there and you're humidifying it, or concentrating the air that's in there, so you get the humidity increased. So increased temperature, increased humidity. You put a dehumidifier on it, it feels better. I've been in multiple chambers now, so I know what I want.
Yeah.
So, and that's why I did what I did. This is going to help me for the rest of my life.
Yeah. Wow. Fantastic. This has been a fascinating conversation. It has had so many layers and different things that we've discussed. I'm really buoyed by the fact that at 54, you've been through so much and you're still working towards making improvements and making changes and benefiting, that are going to benefit your life. Often I ask stroke survivors, how has your life changed since the stroke? And they're not normally 3 months into their stroke journey, but I'm going to ask you that anyway, because I feel like you've had another turn for wisdom, or you've had another turn for thinking about life differently again. So how has your life changed since you experienced this stroke?
Everyday life, I need to go back to work. But I have that problem that you've talked about on many of your things about fatigue. I get tired so fast.
Right.
And I would really like to know. The only reason I know about it that it's a stroke thing is because you've mentioned it.
Mm-hmm.
All the training I've been through,
Uh-huh.
everything I've done, you're the only one that has brought this up. Your guests have brought it up.
Yeah.
So
That's so strange. I can't understand that, but that's okay. Yeah, fatigue, quite normal, not fun, and can be made worse by the food that you eat. So I know that as soon as I eat foods that are high in processed carbohydrates, like bread, like sugar, like pasta, that that food coma that we talk about after a Thanksgiving meal or a big Christmas meal or a big Easter meal, that can happen to me immediately after just a small amount of food. That's just a normal regular meal if I eat those types of foods, and especially after alcohol. So I still experience fatigue as a result of uh, my strokes and my brain surgery and all the stuff that I've been through. But I've been able to really minimize its impact and decrease the severity of it by stopping the consumption, in my case, of uh, breads, pastas, and sweets and sugary drinks. So, uh, so I might be kind of boring to hang out with at lunch or at dinner, but at least I'm going to be awake
yeah.
and productive, and I won't have to separate myself from an event and go and rest and try and recuperate. And it has worked for me. I know it works for other people as well, but I'm not a nutritionist. I'm not trained or qualified anyway. I'm just talking about my experience. And I don't know what stroke and diabetes combined. I don't know how that interferes with fatigue and causes more fatigue. I don't know about that, but I do know that after my brain injury, I also had a thyroid condition, and the thyroid condition was causing the same neurological fatigue that I was experiencing after the brain injury. And at the beginning, it's very difficult to understand what was happening to me. And I was trying to get feedback and information from my doctors about why the fatigue is so debilitating. And I had kind of a double fatigue, if you like, because the thyroid wasn't functioning properly and the brain wasn't functioning properly, and I was eating the wrong foods. It was just really terrible. I couldn't walk from the couch to the toilet and back. So after many doctor's appointments and visits and many attempts to get to the bottom of the fatigue and to try and understand Google searches, what causes fatigue of the brain and all that kind of stuff, and you get a number of different hits. I had these tests, and they accidentally, one of the tests that happened when I was in hospital because I was so lethargic was they did a chest x-ray and they accidentally discovered that I had a nodule on my thyroid gland that was so large, it was the size of a baseball, and it had moved and deviated my windpipe and my esophagus by 6 centimeters, which is about 2 inches or 3 inches or something like that, 2 inches, I think, to the wrong direction. So that scan was the one that revealed that I have a thyroid condition, but I didn't know the gravity of the situation. And what eventually happened is a year after my brain surgery, I had surgery to remove half of my thyroid. And that's why I'm even more susceptible to fatigue, because I have 2 predisposing conditions that both cause fatigue. And if I'm not careful, I could be really unproductive, an entire day. and it's not fun. It's not fun being unproductive. So if somebody out there is watching and listening and they do experience fatigue, just consider some of the things that I said. Ask some trained professionals about what I just said. Do a little bit of Googling and see if there's some simple articles that are verified, that are online, that you can read about that. And you might make a massive difference to the way you experience fatigue.
A simple blood test.
Yeah.
A thyroid panel.
Yeah. Thyroid panel. Exactly. Yeah. You nailed it. Because a lot of people have undiagnosed thyroid conditions. It's why some people are overweight and they can't explain it, and they don't know, how they've become overweight or gained weight all of a sudden. So maybe all the stuff we've discussed is going to just get people thinking. That's really what we want to achieve here. And and share stories. I really appreciate you coming on the show and reaching out. Thank you so much for doing that. I wish you well on the rest of your recovery, and all the best overcoming all the obstacles that you need to overcome. And congratulations on how far you've come so far.
Thanks, Bill. It's fantastic. I searched you out. Once I got in the chamber, I searched you out. Maybe not you exactly, but looked for some of my people.
Yes. Thank you for saying that.
There had to be an answer.
Thank you for saying that, because you and the people that have already been on my podcast are my people. That's exactly how I feel. Like they're my people, because we get each other. We understand without needing to really even talk. Really, we could have just done this in 5 minutes. We completely understand, but I get it. You're my people. So thanks for being on the podcast.
You're very welcome. It's my pleasure.
Well, thanks again for joining us on today's episode. To learn more about my guests, including links to their social media and other pages, and to download a full transcript of the entire interview, please go to recoveryafterstroke.com/episodes. If you'd like to purchase the course, 5 Foods to Avoid After Stroke, go to recoveryafterstroke.com/courses and get on board now. If you would like to support this podcast, the best way to do it is to leave a 5-star review and a few words about what the show means to you on iTunes and Spotify. And if you're watching on YouTube, comment below the video, like this episode, and to get notifications of future episodes, subscribe to the show on the platform of your choice. If you are a stroke survivor with a story to share about your experience, come and join me on the show. The interviews are not scripted. You do not have to plan for them. All you need to do to qualify is be a stroke survivor, or care for someone who is a stroke survivor, or you are one of the fabulous people that help stroke survivors. Go to recoveryafterstroke.com/contact, fill out the form, and as soon as I receive your request, I will respond with more details on how you can choose a time that works for you and me to meet over Zoom. Thanks again for being here and listening. I truly appreciate you. See you on the next episode.
Importantly, we present many podcasts designed to give you an insight and understanding into the experiences of other individuals. Opinions and treatment protocols discussed during any podcast are the individual's own experience, and we do not necessarily share the same opinion, nor do we recommend any treatment protocol discussed. All content on this website and any linked blog, podcast, or video material controlled this website or content is created and produced for informational purposes only and is largely based on the personal experience of Bill Gassiamis. The content is intended to complement your medical treatment and support healing. It is not intended to be a substitute for professional medical advice and should not be relied on as health advice. The information is general and may not be suitable for your personal injuries, circumstances, or health objectives. Do not use our content as a standalone resource to diagnose, treat, cure, or prevent any disease for therapeutic purposes or as a substitute for the advice of a health professional. Never delay seeking advice or disregard the advice of a medical professional, your doctor, or your rehabilitation consultation program based on our content. If you have any questions or concerns about your health or medical condition, please seek guidance from a doctor or other medical professional. If you are experiencing a health emergency or think you might be, call 000 if in Australia, or your local emergency number immediately for emergency assistance, or go to the nearest hospital emergency department. Medical information changes constantly. While we aim to provide current, quality information in our content, we do not provide any guarantees and assume no legal liability or responsibility for the accuracy, currency, or completeness of the content. If you choose to rely on any information within our content, you do so solely at your own risk. We are careful with links we provide. However, third-party links from our website are followed at your own risk, and we are not responsible for any information you find there.